So, welcome to our meeting. This video production is a planetary education project of Life Celebrating Health. And what we're doing is more than fun. I would warn you, that there's FBI interrogation on everyone who ever makes a copy of anything. So you would think that this disc is one of those because it'll be a DVD for you to hand out, but ignore all that FBI stuff because you're free to share copies of your DVDs when we get them for you to anyone who has a need to know. And of course, that means that folks who are suffering will thank you forever for sharing that.
And so immediately, I think I got back it happened on Friday. I was in his office on Tuesday, and he said it was very good because a lot of people come, they wait, and the sooner you get in, the better. And so he did, I don't know how many treatments, but for all practical purposes, my shoulder, other than a little click, it's perfectly okay. No problems at all with that. And I don't remember how many treatments I had, more than I wanted. I wanted one, but it did take more than that. And since then, I've had a few problems with other joints. Currently, I twisted my knee, and you've been working on my knee because I want to go skiing again here in a couple weeks. And the knee, fortunately, very small ligaments, and it's much better. I am confident I will be able to ski without any problems in a couple weeks.
I'm Bill Turk, and I've been going to Dr. T's office for around 10 years now. And the reason that I started was because some of you may understand what I'm about to tell you. I was married. I still am. I have a happy marriage. The reason, my wife found Dr. T, and she went to him and she told me that I was going. So I went to him so that I could have a happy marriage. I'm still going to him, and I still have a happy marriage, okay? But I was suffering from a lot of things. I am diabetic, as you might have guessed. I was on 5 diabetic pills. He put me on some different medication, changed things around a little bit, and the net result was I found myself in handcuffs. I didn't stop all the other medications, and I changed my way of eating, and I had a low blood sugar episode, and the police didn't like me wandering around the neighborhood laying around in people's front yards. So they put me in handcuffs. They got the medics out, and they gave me some glucose and drove me home. Well, then I realized I had been over-medicating, and I didn't need all that stuff all those other doctors had given me. And I got off on to just a couple of pills a day instead of 5, and everything settled down and worked out very well for me. I can't blame the doctor for my weight problem, but that's not because of his lack of trying. I'd gone to chiropractors, I'd gone to lots of other people during my life. I was suffering from pain in my neck, I had pain in my middle back, I had pain in my lower back. I took my x-rays in. He throws them up on the wall like this and looks at it and says, "You got a rodeo injury." A rodeo injury? What in the world is he talking about? And I got to thinking, 20 years earlier, I'd been in an automobile accident. It actually broke the back of the seat in the Cadillac, okay? I got rear-ended down southwest Houston here. Gal was driving a pickup truck at, I would guess, somewhere over 50 miles an hour and hit me in the back end. And I thought I was supposed to feel that way. He looked at it and says, "Yeah, you got that rodeo injury, and I think I can help a little bit." So we did the neck. My neck was giving me problems. We did the RT on the middle back, and we did a couple of RTs on the lower back. I think now looking back on it, I think it's been 3 years since I had an RT treatment. I'm kind of a exceptional patient, I think, because most people have to have a few more than that, or maybe I just wasn't as bad a shape. I can't stand pain. I'm not going there. I'm not going to tell you about the treatments and what they are, okay? We'll move away from that. But I'm standing up here today to tell you that that RT for me has worked a miracle. I haven't been to the chiropractor in 3 years. I would recommend that if you've got, you know, I must have a dozen friends that won't take my advice. And they listen to that medical doctor, and they go in and they let him slice them up the backside and put those rods in. I've got a granddaughter, 17 years old, and she had rods put in her back. What is she? She's about 38 now, and she's had a couple of children, but they've all been a problem because she's got these rods up her back. She has real pain with it. I know another fellow that has back pains, and he went up there and let them split him open like a wild turkey, and they put him back together, and they put a TENS unit on him to try to stop the pain in his back. He can't get up and walk more than about 2 blocks before he has to sit down and try to find some way to get comfort from that back pain. Would he go to Dr. T? No, he'd rather go to the guy and pay the big bucks and experience all the wonderness of modern surgery and all the pain that stays with it afterwards. So, you know, like Dr. Trowbridge mentioned, the choice is yours. Do you want pain, or do you want somebody to do something about it? Do you want somebody that can help you with your diabetes, or do you want to just go get stuff with more pills and put on the glucose and other things? You know, it's kind of your choice. So, you know, I've had just about every treatment that Dr. T has, and you know, it's a unique service. I walked in there one day, and I'd had some kind of a bite on my leg or something, and it kind of had a little old sore about the size of a quarter, and I wasn't at all worried about it, but I showed one of the nurses in there, pulled up my pants leg, says, "Look at what I got." She looked at it, she says, "That looks terrible." I says, "Oh, it's not bad." She walked off, and about 15 minutes later, she came in there while I was chelating, and she says, "Dr. T wants to see you." And I went in, he took one look at it, and he says, "You've been bit by a brown recluse spider." Well, I went home afterwards, and I found a whole bunch of them out on my patio, okay? And me and them have parted company. But he says the reason it wasn't any big, he says the reason you get to keep your leg is because you were chelating. He says, and then he went through the mechanism of how the chelation helps destroy the poison. Well, I'll tell you what, if that brown recluse spider was any worse than what I had, I didn't want to fool with them, so I got me some dust and stuff and went out and did that whole patio. But I've had all kinds of little old problems like this that have come up, and he's had treatments for them. I went in and spent a week at Methodist Hospital, for example, tell you about chelation. They ran everything they could find on me. They knew this old fat boy, that he was just absolutely had to have heart problems. His veins had to be all plugged up, etc. They ran their MRIs, they ran their CTs, they ran their sonograms, they put units on my big toe, and they put them on my thumb trying to measure the blood flow, because they knew that there wasn't any blood flow. And when they got through with all the tests, yeah, there was blood flow, and yeah, there wasn't anything wrong with my heart. And that, yeah, they were going to have to turn me loose because they couldn't find anything wrong. Now, that's great news, okay? But you know the sad part of that news? Not one of those doctors bothered to ask me why. Why was my blood system in such good shape? Not one of them was curious. Now, what kind of a doctor is that doesn't want to learn how a patient is maintaining his health? You know, makes you really wonder about the oranges in life. All right? So that's kind of a synopsis of 10 years of going to Dr. T and getting the great treatments that he's had to provide. And it does work. And I encourage all of my friends to go see him. And they look at me, and they say, well, is he covered by insurance? Well, no. I just had this discussion the other day with somebody. He says, well, you know, gee, I think I'll probably go get my back operated on, you know, because it's covered by insurance. Pardon me. Let me ask you this. Would you rather go in there and get RT for a couple of $100 and get to feeling better right away? Or would you rather go in that hospital and be laid up for several weeks and then find your back still hurts and then have to pay the insurance deductible that they're going to charge you on that $20,000 or $30,000 operation if it's that cheap? That's going to cost you well over $200, I guarantee. You know, but like he says, I told him, the choice is yours. So thank you all very much for allowing me this moment to get up here and talk to you.
So the title of my talk today is Apples and Oranges. Could an apple a day truly keep the doctor away? I, of course, am Dr. John Parks Trowbridge here in Humble, and I welcome you to our seminar today. Now, we all know what's important in our lives. We want to be healthy and happy. But can you afford to be healthy? And can you truly be healthy? So this seminar is to help you get those answers now. The situation is very simple. We want the very best of everything. The best in our automobiles, the best in our homes, the best in our furniture and other home decor. We'd love the best clothes and jewelry and other comfort items. We'd love the opportunity to take vacations, travel the world, see whatever we want to see. We'd like the latest in electronic gadgets. For those of you who don't, share them with me. I'll take them. Most of all, we want the time for the most important people in our lives and time to relax with them and enjoy. And the time to share laughter and playtime with all of them. And the time of our life on earth is brief, and is there any reason not to seek comfort and joy while we're here? Now, the goal in getting healthy seems elusive. So the real challenge becomes, how can you find what really works and what is best for you? I think all of us would agree that the medical world is confusing. Your doctor, the TV talking heads, newsletters, newspapers, all offer conflicting advice. And you know the hallowed halls of the hospital is where the major life events occur: birth, suffering, death. And these give to the hospitals a quality of awe and admiration, even fear. Yet home is where the heart is. And that's where we live out our daily lives, our struggles to find love and comfort, satisfaction, joy, and even meaning in our lives. So let's now compare apples and oranges. If oranges are the usual medical care that we've all grown used to, and apples are natural healing, which is what we're introducing today, it's interesting that doctors claim that natural methods don't work. Now, they claim that these different approaches don't work, and they're even quackery, but in fact, many folks believe that the usual medical care doesn't work. In fact, all of the patients who show up in our office at Life Celebrating Health have come to that conclusion because it didn't work in their lives. So apples or oranges? Well, people ask that question, but each approach should be chosen for what it does best. But how do you tell? You look at the weight and the size. Will that comparison mean anything? Are big hospital buildings more important, more better? Are fancy doctor outfits and fancy offices better? An interesting question. You should spend your money wisely for the best results rather than wastefully, because remember, we want to spend it on the best of everything else. Some folks rush to surgery for a quick fix, but what if the results are less than desired? Some folks reach for tablets and say, well, I'm okay. But the question is, if you're fixed, why do you still need to take medications? Rapid results might not be the best answer. Now, popping a pill is always better, right? It's certainly easier, but the convenience that you trade right there might be very significant. How about the old saw, no pain, no gain? Well, that sounds awful, no pain, no gain. Knock me out and fix me where I can't feel anything. I want to feel no pain, right? And that choice for comfort sometimes compromises what we actually want in terms of final results. What about, should we choose what's easy to access or to experience? What happens when the treatment experience isn't what you wanted, especially in terms of the result? Now, isn't safety always your very first concern? It certainly should be. I promise you, it should be your first concern. But effectiveness matters as well. Isn't whether something works, whether it's effective for what you need, your very next concern? And what about future therapies? For example, if you have a joint replacement, that prevents you from having any further treatments that might be developed or could be used in your situation. So surgery sometimes takes you down a one-way street from which there is no other option. So here's my professional advice. Choose healing. For most everything that ails you, choose natural healing. You can always have more medications and more operations in the future. But the question is, did you trade your natural healing for drugs and surgery? Are there benefits to natural healing that you have traded for a bowl of porridge called drugs and surgery, never realizing that you did have the choice for natural healing? Now, we all know about bitter lemons, and we avoid those. What about bitter oranges? No, not just bitter medicines to swallow. Sometimes you find bitter, not better, results from surgery. So in that vein, let's think about nothing worth doing is easy. Well, if you search the internet on Google, how do you choose of the 1.6 million sites that are hits on that search, which will tell you the most important information, which will tell you where to go, which will give you the best choices? So I'm going to give you some perspectives now. Let's go back to oranges. You really need to rely on an expert to help you see the benefits and risks of apples or oranges. And that's where you rely on a physician who knows and can help you best. Now, the usual approach in medical care is more drugs. And the other usual approach in medical care is more surgery. Well, my question then comes, how's that working for you? Short-term limitations can become long-term before you even realize it. And then what do you do, Ollie? Remember, with surgery, there are its own special risks. Things happen. Scars form that we're not happy with. Instruments rarely, but sometimes do get left in. I like the situation. This only happens 1 in 1,000. It doesn't matter to the other 999, only to the one that would be you that it happens to. Remember that drugs prescribed by doctors have their special risks as well. You see more and more advertisements for 1-800-BAD-DRUGS where you can go sue for what happened. Because remember, the FDA approved each of these widely used prescription drugs as safe and effective, the FDA is watching out for you. Now remember, that's just a short list, and here's more bad drugs, again on a short list. Vioxx, widely touted as one of the best arthritis or joint pain medications, has killed over 55,000 people, especially with heart problems. So only later do we sometimes see devastating dangers. Well, what about more bad drugs? Perhaps Boniva or Fosamax, widely advertised on television now. People sometimes ask, why do we go to all the bother for natural healing when there are drugs easily available? Well, dangerous drugs such as these are used because doctors simply don't understand how to use calcium and vitamin D, hormone therapy, chelation therapy, and others to help build stronger bones. And yet the risks of Boniva, Fosamax, and similar drugs should be read before you ever put a pill in your mouth. What about more bad drugs? Here's a couple that you might not have thought about: aspirin and acetaminophen or Tylenol. They have their own special dangers, and sometimes it's hard to believe that common items could be deadly. If you have questions about that, Google side effects, deadly effects, adverse effects, and the name of the drug. Our world is changing fast. It is definitely a future shock. This was proposed 40 years ago by Alvin Toffler, that we start looking at the trends rather than the experiences currently available. The worst assumption is that high-tech drug and surgery inventions are better than natural healing. Now, the reason I say that's the worst assumption is because, is it true or not? So the question comes up, what are apples all about? While we think of natural healing as something soft and pleasant like herbs and massage, our scientific advances have given us hundreds more effective and safe treatments that stimulate, promote, encourage natural healing that God built inside your body. When you get a cut, you don't need a surgeon. It begins to heal right away. It's only the bigger cuts that need medical attention. Now, natural healing is not fantasy. These treatments aren't flights of fancy or fantasy, and many believe that we've lost the war on cancer, claiming that chemotherapy is the biggest unicorn of all. When you start looking at it from that perspective, the apples and oranges question becomes much more interesting. Natural healing really is high-tech, serious business, every bit as sophisticated as landing a jet on a carrier. So what do you really do in natural healing? How does that work? Well, the first thing is we look for and remove what's blocking you from getting better. And we work to remove that because it's personal pollution that is interrupting the way your body can heal. We look for and provide what trace factors that you need, but they're missing. So nails are very tiny trace factors, but when you try to build a house without them, it ends up looking much more like a log cabin. That's important to have those inside. We look for and find switches that you need to have turned on in order to heal, and then we turn them on. So the question really comes, is medical care, oranges, usual conventional care, really stuck in the 1950s? Because if that drug and surgery approach has outlived its usefulness, what is next? What options do you have? Perhaps the most obvious change in our daily lives, when we look at 50 years ago back in time, is the change from corded phones, and remember those ancient dinosaurs, the payphone? Because in 2010 we have apples. Look what modern technology has brought you. In 1950s, looking back some years in time, we had black and white televisions. And look what 2010 apples have brought to you. That is modern technology. In 1950, the oranges were these ancient stoves and ovens. And look now what 2010 apples has brought to you, the results of high technology. Flat electric burner panels, convection ovens, not to mention microwaves. 1950s oranges includes, when we look back some 50 years, the typewriter. The 2010 apples show you what modern technology has brought for you. The 1950 oranges includes the slide rule. Looking back 50 years, this was the best way to make any calculation. Unless, of course, you were Chinese and could use an abacus. But now the 2010 apples have brought the convenience of modern calculators to us for mere dollars. And there's one on every one of our desks where we want to use one. 1950 oranges brought us the Edsel. Who remembers the Edsel? And now look what modern technology has brought you. However, there are some other issues. 1950s technology, when we look back, brought us oranges called the squad car. And now look what modern technology has brought to you. Not to mention the red light cameras and that wonderful, but officer, I was only right. 1950 oranges brought us the most modern in air transportation. And looking back that 50 years, we never would have expected what we have now in 2010 with Apple's, the modern technology of intercontinental transport that goes for dozens of hours. And then on the health note, 1950s oranges, well, that surgery back then was hampered because we didn't have as many advances in anesthesia, antibiotics, and many of the techniques and technologies, joint replacement and such, that we did not have available then. And yet, in 2010, it still looks very much the same. Despite these advances that we have in surgery, it's still the same old approach. Well, who matters in this regard? Well, you matter. You're the patient. Now, it might be the same operation, but it's major surgery when it happens on me. Of course, it's minor surgery when it happens on you. That same goes for side effects of medications, like losing your hair with chemotherapy. Aren't you glad we can do chemotherapy? I know you lost your hair, but that's no big deal, unless, of course, you're the one. So 1950 oranges, when we take a look at space technology, we see that natural healing has emerged as a powerful technology as we've made these advances in our physics and biology and biochemistry technologies. So when we look back 50 years in time to the first satellite, Sputnik, and then come forward to 2010 with the apples that we have available, look what modern technology has brought you in the International Space Station. 1950, we had the most modern military pilots. And yet, that highest technology back then looks primitive when we look 50 years ago and compare it to what 2010 offers in terms of apples. Look what modern technology has brought you. And in terms of military performance equipment with regard to those applications, this was the famous F-86 Saberjet that helped win the Korean War. And yet 2010 apples brings us modern technology in the form of the F-22 Raptor, the most advanced stealth fighter in the world. When we talk about airplanes, a subject dear to my heart, the 1950 oranges shows us the Cessna 172, the premier 4-seat private plane in the 1950s with full equipment for instrument flight. Now the modern Cessna, the 2010 apples, if you'll notice, has airliner quality equipment. Those instruments are available now in small planes, including the small trainers. 1950 oranges, when we look back 50 years, we see an x-ray machine that could look inside you. Very impressive. And now look what 2010 apples have brought to you. This technology has safer ways of looking inside at how your organs are made and how they actually function. And these advanced instruments play an important part in natural healing. So when we think of 2010 apples and natural healing, we're thinking of gentle technology, evidence-based discoveries that wisely guide us to new horizons of healing. We welcome technology that involves machines. It's long past time to finally embrace truly modern healing. Now, 2010 apples. You always see the advertisement somewhere that says individual results may vary. Well, we say individual results will vary because one size, one drug, one operation doesn't fit all. We are all individuals with our own special needs, our own background, our different healing requirements and treatments that are needed to help us heal best. Now, when faced with confusing and costly and risky choices in medical care, don't throw in the towel. That's just foolish. Don't resign yourself to the kind of opportunities that are so limited in terms of drugs and surgery. Your choices actually can be quite simple, like the new Apple iPad. one button, on and off, and a finger touch screen that gives you full control over all of the other features. That is the kind of opportunity available to you in natural healing. Now, medical care helps great with acute injuries. Medical care helps great with acute infections. Don't you just love shaking someone's hand after you look at this picture? But usual medical care, the oranges, can help only partly with lifestyle illnesses. You can't medicate yourself out of diseases that you behave yourself into. My friend Roby Mitchell came up with that very elegant phrase to compare oranges and apples. Aging changes happen to all of us, but only natural healing can help preserve youthful vigor and function. Natural healing is for all ages. As I showed in my book, The Yeast Syndrome, no age is too young or too old for natural healing to be effective. So what do we do in natural healing? A whole variety of treatments for the vast majority of human ailments, regardless of diagnosis, regardless of what you've been told is your only option, regardless of what you've been told is there's no way out, you just have to learn to live with it. Regardless of all these things, natural healing often provides comfort and sometimes even dramatic improvement, dramatic changes that you would never expect. Because you see, you deserve the very best. Now, unlike new drugs and new operations, advances in natural healing technologies are safe, gentle, and effective. They are new. They are not scary. You might ask, is this our first rodeo? Well, it might be your first rodeo in terms of trying natural healing, but it's not ours. We've been offering natural healing treatments for over 30 years. It's simply to the people who've shown up, and you might not have yet come in. So you owe it to yourself and to your family to get our free CDs and DVDs, to get our recommended books, to learn the facts you need to know. And of course, many of these we've written or produced. We encourage you to see both sides, apples and oranges, especially the benefits and risks, because sometimes some of our patients are surprised we suggest drugs and surgery, because what you're after is the best for your particular situation. Listen to others. Talk with our patients about their successes. Come visit us in the office. Come talk with people on the telephone about how they have had benefits from apples instead of oranges. So, should you ask your doctor whether this is right for you? Well, we would suggest that you avoid asking an orange medical doctor about apple natural healing, a special kind of health care and treatment that he probably does not know much about. So you know the old story, well, ask your doctor. Well, you wouldn't ask a vet who doesn't know anything about human treatments, so don't ask a movie actor like Marcus Welby, MD, regardless of how persuasive he might appear in a television advertisement. Don't ask your neighbor or anyone else who actually doesn't know the facts about natural healing. Refer to someone like Robert Atkins, pictured on the left. Sorry, the right. See how easy it is deceptive that someone who looks good may not know good information for you. So, I ask you, do you see two Indians? Because you might need a specialist in natural healing. The fox is obvious and easy to see in this picture, but the more important details often require much more study and experience. That's what the specialty of natural healing is all about. Thanks to Bev Doolittle for this wonderful illustration to show us how easily our minds are tricked because everyone else is looking at the fox. Everyone else is choosing oranges instead of apples. It's time for a change of perspective. What's unrealistic is to expect that drugs and surgery create or promote natural healing. Simply doesn't happen. This is a change you can believe in. The choice is yours, and remember, what choice you make, what you decide for yourself, matters a great deal for you, your family, your future. This is the time of your life. This is not a dress rehearsal. It is the real thing. The time of your life can be shorter or longer, more vital or lackluster, more robust or fatigued. So, which should you choose? I say choose life, and choose life celebrating health. There is more fun to be had in your life. Go for it. Find that bigger fishbowl that you would much more enjoy than your current limitations. Choose robust health. Choose to be healthier and happier. It's what we want. It's what all of us want. It's right here for the taking, literally within your reach right now, today. So what should you do now? We say dial 1-800-FIX-PAIN. Get our CDs and DVDs, recommended readings. Come by or call to talk to our patients. Ask about their results. When faced with the choice of apples or oranges, dial 1-800-FIX-PAIN. It's the right thing to do, so you too can be happier and healthier for your coming years. Life celebrating health today and tomorrow. I would like to assure you that no animals were harmed in the making of this presentation. No doctors were intentionally harmed in the making of this presentation. And this is available now in a home theater near you. Share this with your friends. And remember to tell them for details to dial 1-800-FIX-PAIN. Thank you so very much.
I found Dr. T through my dentist. I go to a holistic dentist, and he introduced me to Dr. T. Well, I was in trouble. I was hurting so much, I couldn't stand it. I had a pain in my side. I did not know what was wrong. I'd been on every diet that you could imagine. I was just in agony. And so I went to see Dr. T. Had a big stack of paperwork I had to fill out. Boy, I filled it out because that was worth it. I had to find somebody that could take care of this pain. Well, I went in to see Dr. T, and he listened to all my stories, listened to all the diets that I'd been on, and what wonderful little health things that I had been doing. And he looked at me and he says, "You want to know what's wrong?" And you know that little funny laugh that he has. He says, "I can tell you." And I'm going, "Oh, good, good. I'm ready for this." He says, "You got shingles." I said, "Well, can you fix me?" Of course. He put me on an IV, and in 15 minutes, my pain was gone. He gave me medication. In 2 weeks, I didn't have the shingles anymore. Well, now to me, that was pretty miraculous because I hadn't been able to sleep for probably a month. I had been up on you know how, if any of you have had the shingles, you know how you feel, okay? He fixed me. Well, I was hooked from that point on. Everything else that happened to me, I came to see Dr. T. Well, a couple years later, I got injured on the airplane. I was a flight attendant. I was putting some bags up in the overhead, and I ended up hurting my neck. Then I went to see Dr. T. He gave me some RT. Well, then I was working in the galley a couple years later. Pulled out a carton of orange juice. Really hurt my neck. Hurt my lower back, too. Went to see Dr. T. Of course, by then I'd gone to the company doctor, and they were looking at maybe, hey, you might want to consider quitting flying. Well, with Dr. T's help, the help of 4 chiropractors, and the help of a lot of work hardening, I was able to go back to work. I was able to go back to work for another year. I have retired now, but you know something? I can do stuff with my retirement. I can get out, I can go work at a wolf sanctuary, I can do all kinds of things because Dr. T fixed my back. Dr. T fixed the 3 herniated discs in my neck, the 4 herniated discs in my lower back, and now I'm a functional human being. So I have a lot to thank Dr. T for. And I thank you for the opportunity to tell you my good story, and I thank you, Dr. T, for my life.
I sat here and You're going to hear my story briefly in a few minutes, but I'm here for a more important reason. Dr. Faber asked me to, and I do have the privilege of presenting Dr. Trowbridge with a citation of appreciation. And there was 3 or 4 of us patients, I think, that actually had something to say on here, but I've been in the clinic for probably close to 11, 12 years now. And I can say probably hundreds of patients that I've talked to would have been very, very happy to sign and acknowledge Dr. Trowbridge with this certificate. Is Susan Rogers here? Susan? She's one that, of the signees, and I'll just let you come on up and tell you a brief story, and if you want to read your brief note, that's fine if you don't right now. Sure.
Can everyone hear me? Okay, I'm Suzanne Rogers, from the Woodlands, Texas, and I've been coming to Dr. Trowbridge for about 4 years. Just a brief summary here of what I've written in honor of Dr. Trowbridge. I suffered a chronic infective septicemia causing severe fatigue, pain, and lack of sleep. I required an IV of antibiotics as well as high-dose clindamycin, which I still take the oral dose, but I'm avoiding a lot of my IVs because of the customized treatment that I'm receiving. I did natural immune boosting treatments as well as customized medical treatments as directed by Dr. Trowbridge when the previous treatments failed to provide improvements. Dr. Trowbridge saved my life from one of daily pain, suffering, and disability. Thank you. Do you want me to go on to the rest of it? I would like to cover some of the other things that have been really important to me, because in 1983, I was injured while flying on a major airline. I had 2 back-to-back injuries, and the interesting part of this is when you have an injury, anyone that's had an injury, you know that everyone in the world wants to take out a part of your body. So 50-plus doctors all wanted to operate on 3 discs. My hands, they wanted to take out 2 ribs. For some reason, I resisted all of them over the course of a 5-year period. And during this time, I realized I was really sick, and I knew I had a massive infection, but nobody would listen to me. All they said was I didn't want to go to work. So in walks my first shrink, and he gave up on me within 5 minutes. He said, "You're fine. You don't need me." Anyway, so my good friend of mine knew a doctor in New Orleans that studied bacteria. I went to him, and within 45 minutes, I had an answer. He used a test that pathologists do not use in this country anymore. Anyway, that doctor treated me every 3 months until he retired in '01, and then he passed away in a couple of years. His wife found a doctor in Georgia, so for the next year, I went to Georgia. That doctor, fortunately for me, said, "You know what, you would really benefit from chelation therapy," and I happen to know a great doctor in Houston. So all these years now, think about it, I traveled every 3 months to go and be treated, and I could have been here. The crazy thing is I knew about this doctor because he did FA, he worked for the FA and did a lot of the, pilot medicals. Anyway, I was so mad at myself. I thought he's been at my back door, 40 minutes away. But when you have to understand, when you're doing all the stuff I had to do for all those years, the last thing you need is another doctor. So I kind of ruled him out. And he, just was kind of, I guess, in my hip pocket. Anyway, the doctor in Georgia encouraged me to give a call, and I did. And I want to make a comment about my husband because he's 10 years older, and so when I made the decision that I would go to Dr. Trowbridge, I told him I made the appointment, but we were both going, and he said, "No, I don't need to go." And I said, "Well, you're 10 years older. I'm not going to prolong my life without prolonging yours." So the other interesting part of his story is I think he decided on his own, I don't know, Dr. Trowbridge may have told him, but he decided to go have a heart scan. He was told that he would have a major heart attack in 5 to 7 years. So we both made a big commitment to chelate every week for that year. And at the end of the year, he went back and had a second heart scan. And our other doctor that satisfies the side of the PCP for your insurance companies looked at us and said, "There's no way. I mean, that's not what happened." He said, "Well, then they just diagnosed it all wrong and read it all wrong the first time, because that wouldn't do that." So anyway, back to my story, though. I now am able, whatever he has told me to do, I do, and I am able to go 9 months. And when I do get a little sick, it's nothing like what I used to, because when I got sick prior to Dr. Trowbridge, I literally thought I would die, and I would think I will never make it to go out of state for the next treatment. But anyway, this man, I believe, is probably going to get me where maybe I don't even have to go and have these treatments if I'll just continue to listen to him. So anyway, he's a great person, and I know all of you would agree with me.
I'll make a short statement first. God is the creator and preserver of all mankind. Dr. Trowbridge's work has enabled me to enjoy superb health after suffering both back and heart problems. Dr. Trowbridge is God's blessed minister of medicine. I really believe that, ladies and gentlemen, from the bottom of my heart. 12 years ago, I almost died of a major heart attack and went to 9 different cardiologists, almost died about 4 times. And just by an act of God, Mr. Apple at the Thrifty Pharmacy led me over to Dr. Trowbridge. He said that there was a man in town called the Rumble and Umble that had the alternative medicine process that could heal somebody. I had no idea that there was an alternative. And I was led over to Dr. Trowbridge. I think it was primarily just an act of God. And from the alternative chelation therapy done on my heart, 7 or 8 years, well, let's see, 2 years ago, I suffered, I was enclosing a petition in my new flower shop that I had just reopened, and ruptured several discs in my lower back. And well, it was surgery time again. And 19 years ago, when I was a carpet layer, lifting heavy rolls of carpet for 13 years and crawling around on the floor and getting up and down, working on your knees all day long, I did some serious damage to my body, big time. And I had to get out of the floor business. And I was forced into the flower business. So what does carpet and flowers have in common? It's called making a living. So here I am in the flower business again, and here I'm putting a door up and on a petition, and I ruptured my disc. Well, I had the surgery 18 years ago, which I never got over. I said, man, I don't want to do this again. And I've been hearing about reconstructive therapy. Dr. Trowbridge gave me 30 of those treatments. It took 30 treatments of reconstructive therapy to get me back up on track. I'm going to tell you right now, I've been on both sides of the fence, and believe me, this side of the fence I'm on now is a lot better, I promise you. That grass over on that other side, where they take a knife and stick it in your back, folks, that is not fun, and it don't work. It didn't work for me then, and I can tell you right now, I'm back. I was up and walking around and doing the things I wanted to do without surgery. And I'm virtually painless. And there again, I'm still not over that surgery I had 18 years ago. I still have a problem with my left leg. I'm now walking with a limp because they took some stuff out, and he can't fix what ain't there. What can I say? Dr. Trowbridge, you are truly God's minister of medicine.
Ron Carter, I would like to introduce Ron Carter. Who is Ron Carter? This is Ron Carter.
John loves to talk about that. Yes, at one time I was the guy in the car dealerships in Alvin, and they have that little sign, billboard that was up there. It says, "Who is Ron Carter?" Well, next time if they have it, call them, see if they give you a prize. Very briefly, I played college football at Michigan State University. and many other sports, and I was beat up pretty bad over the years. Couldn't get really hurt back in those days. If you got hurt, you lost your position. I was a blocking fullback, which meant I had to hit the big linebackers, the defensive ends. I had concussions, I had knee problems, surgeries, everything else, and ended up here in Houston, Texas, of all things. And at the age of 50, I can't move my right shoulder, can't sleep. Still had a very active life. Down at a deer lease, chucking corn. Now I have a cattle ranch in Mena, and I'm still throwing things around, but I couldn't move. And I took a newsletter from a Dr. Douglas. Some of you probably subscribe to certain health newsletters. This guy was William Douglas. And I read it religiously every month. And it said, if you ever have a problem with rotator surgery, don't consider the alternative, which was called reconstructive therapy. Well, I can't move my arm. Ready to go in for surgery. Had a friend that was going in. My brother calls me probably the week before I'm making this decision. He had one of his best friends, routine operation on his shoulder, died of a blood clot, same surgery, rotator cuff. That did it for me. I searched my records, which I'm kind of a pat rack anyway, found it, and lo and behold, I find Dr. Faber's name, which I looked it up and I called his office. Now, he told me the other day that he never talks to anybody on the telephone, which I can understand, but he did talk to me that day by the grace of God and said, you're in luck. At least I trained a doctor in your area for reconstructive therapy. I saw Dr. Trowbridge, went through the process, got the book, The Pain Go Away. He didn't give it to me, by the way. I think I bought that book. And I read it, started treatments, and after the second treatment, actually after the first treatment, the pain was gone. It was amazing. I could sleep. I couldn't sleep longer than 45 minutes prior to that. Went through a series of treatments, was repaired. Started going just like nothing happened. I think I'm one of those 150% guys, Doc, that my shoulder was much stronger. Well, I re-injured the other shoulder. Same thing. Went right back in, got it fixed up. Well, I just can't believe it. I had arthroscopic surgery on my knee from football. Doc said he could fix that up for me. So I said, let's do it. I'm a believer. Fixed up my left knee with a series of treatments. Even though I had surgery, it's still bad. I was limping. After the surgery, I felt great. Shortly thereafter, my right knee swells up about the size of a watermelon or cantaloupe at least. He comes in, he drains it, looks at it, says, I can't fix you. Go get some surgery downtown in Houston first, and then we'll work on it afterwards. There was a flood in 2001 or a hurricane here. I can't remember which one it was. They canceled all the surgeries. I'm scheduled to visit my son in Alaska, who's working as a fishing guide. I said, Doc, let's go try some treatments. So I've got to go. 4 treatments later, I don't have a cane. Swelling's down. I spent my 10 days with my son. Came back. Finished up the right knee. Okay, this is 1999 and 2000. Talked to the surgeon afterwards that was going to work on my knee. I told him what I did. He laughed, he scoffed, and literally told me, I'll be back to see him shortly. It's a temporary situation. That was 8 years ago. The last thing I did fix was the last presentation that Dr. Faber put on my back. I injured my back lifting weights in college, popped the deal, and I had a protruded disc. This was bad. Many of you have back problems. The knee and the shoulders are bad, but the back is nagging. I think I had 8 or 9 treatments on my back, and here I am now at the ripe old age of, well, let's say I'm over 60, and I lead a very active life and do just about everything I want to do. It's a miracle. I understand a little better what happened after watching Dr. Faber's presentation. You can read a book all you want, but I picked up some things, some good tips. I've tried to explain this to my friends that have different surgeries. They go to their physicians and they're turned away, or it's an insurance item. I had insurance at the time too, but I was not about to take the risk of surgery. I'm fixed. It's been over 10 years, and I think Dr. Trowbridge and Dr. Faber are miracle workers, and God bless them. I just have my little, well, they also mentioned they want to prepare your body for healing. I think I was a pretty amazing case for Dr. Trowbridge because they did a metals test, and I was familiar with chelation therapy. I also did that. I was very religious also with the supplements to take them and the exercises. And I think through today, and I had no heart problems. Well, did not, or not aware of them. But I took the chelation to remove the metals and to heal myself, and I think I've had over 100 chelation treatments, and I come in now once a month from the great state of Arkansas, and or actually see doc a little more than that just to get a monthly treatment of chelation. If I need another RT therapy, I'll take it. You look at the needles. A lot of people don't like needles. It's a small, thin needle. The pain of the injection is nowhere near the pain you experience on a day-to-day basis. Matter of fact, I make a joke. He enjoys it so much that sticking that thing, and he's talking so much, next thing you know, it's over. He does hit a couple little spots once in a while that you will maybe let out a few expletives or a few comments. But I've also gone through some other therapies with the man and became friends and have tremendous respect for what these gentlemen do. And if you have any problems whatsoever, I would highly recommend you investigate it. I'm here available also, as well as the other people, to talk to you about it. I'm sold. I wish I could help other people. If one of you, something I said today helps you out, I feel good about that I was able to help you, motivate you to get into the office. My little word was, on the Certificate of Citation of Achievement, was the reconstructive therapy you administered allowed me to lead an active, pain-free, and normal life. Thank you for the miracle, Doc. So thank you for the time, and for you all listening to me. Thank you.
What I wanted to talk about real quick was, because Dr. Trowbridge does chelation with EDTA, and we make the solution for him, that I was talking to somebody yesterday about getting the lead out, because there's lead in cosmetics and stuff, and I told her to begin to look for cosmetics that were lead-free. Then I got to thinking about my postgraduate work in heavy metal toxicity, and I began to think, you know what? I had forgotten this. So I emailed her and told her about this, and this is something every woman from about 46 to on up should know. And that is, as you begin to lose your bone, osteoporosis, not severe, just as you begin to lose your bone, guess where the main depot for lead is? In your bone. So, and you guess what is the main cause for cardiovascular disease in women over 50? Lead. Damages your arteries, and therefore the plaque builds up, and that is the biggest cause for coronary artery disease there is lead. And so as you lose your bone, you release lead, and the lead begins to do the damage, and then you begin to have some problems with coronary arteries and such. So chelation therapy is the only way to get lead out. EDTA. You don't use some of the other therapies. You use EDTA to get that lead out. So when I came over here, I thought, you know, I need to just mention this, because Dr. Trowbridge is the best chelation therapist in the country, if not the world. And so when I have somebody that needs some of that, I always send them to him. But that was just something that I wanted to share with you guys, because many of you don't realize that as osteoporosis occurs, you lose the lead out of your bone storage areas, and then the damage occurs. So you need to chelate that lead out before this begins to occur. And if it's just now starting, get after it now. And that was what I wanted to say.